Director's Desk, the podcast where we spotlight the groundbreaking work of the National Institutes of Health and the remarkable people driving innovation in biomedical research and public health. I'm Dr. Jay Bhattacharya, Director of the NIH, and today I'm thrilled to be joined by Dr. Paule Joseph. Dr. Joseph is a Lasker Clinical Research Scholar, Tenured Investigator, and Chief of the Section of Sensory Science and Metabolism, also known as SenSMet, at the National Institute of Alcohol Abuse and Alcoholism. She holds a joint appointment at the National Institute of Deafness and Other Communication Disorders. Her research is at the cutting edge of understanding the senses of smell and taste and how they relate to conditions like obesity, alcohol use disorder, and other substance use disorders. She and her team are working to uncover how the brain processes chemosensory information and how these pathways shape our eating behaviors, our health, and many other things about how we live our lives. Paule, thank you so much for joining me. It's a pleasure to have you on the podcast.
Thank you, Jay. It's really a pleasure to be here. I think third time is a charm.
Yes,
so
indeed.
We made it happen.
And congratulations on recently getting tenure. That's a big step at the NIH.
Thank you so much. It's been a solid 10 years getting here, so it's great.
So actually, I wanted to start with that. So you have a PhD in nursing and genomics. You study the sense of smell, the sense of taste, and how that relates to obesity and alcohol. How do you prepare for that kind of research career? Like tell me about your research path.
So as you mentioned, I'm a nurse. So I trained as a nurse and later on as a nurse practitioner. And one of the things that was always very, I was curious about was the reports from patients. Patients will often, that I work with patients with bariatric surgery, for example, and they will report that food wouldn't taste the same after surgery. You know, at that time, I didn't know much about taste and smell, and I would tell them that it was anesthesia and it will get better. But later on, we learned that, you know, there was these taste receptors in the gut.
In your gut, so like your colon, your GI tract. Wow.
Yes.
Okay.
So we have, and we call them ectopic taste receptors. But as I was working as a practicing nurse, these were just like phenomenons that patients will report. And I was also working in a nursing home, and you know, in the nursing home, working with the aging population, often they will, you know, we will mix medications with applesauce to make them take their medication so it could taste a little bit better.
I've done that with my kids before.
So as you know, like medications that are bitter are a little bit difficult to swallow. So, you know, like I think it was like those phenomena and, you know, working with kids with obesity. Also, like I worked in New York City. And so that kind of got me curious about research. And I always loved research. So when I decided to do my PhD, I decided to do it in the area of like obesity, and then combined these observations with taste and later on smell. And so finished my master's degree as a family nurse practitioner, went on to get my PhD at the University of Pennsylvania. And there I discovered there was the Monell Chemical Senses Center, which is a center dedicated to the study of taste and smell. So that's where I
So you had a clinical experience.
Yes.
Helping you get inspired.
Yes.
You went and got a PhD and learned about the chemistry of smell, and the way that our body manages smell and taste, and how it links to, you said, obesity.
Yes.
And alcoholism. Okay, that's what you study.
Yes, that's what I study. And later on came to the NIH as a postdoc. But prior to that, I came to the NIH as a fellow. So I was a summer intern here at the NIH. And I was still in grad school at the time. And it was during that time, the National Institute of Nursing Research had a bootcamp in genomics. So, you know, like sometimes our training in nursing didn't have a lot of genomics.
So genomics means what exactly?
So like this is like the study of like genetics. So how our genes influence, you know, our health outcomes, and that's what I was interested in.
So people might have different shades of the sense of smell. They might have different shades depending on their genes. Or does everyone have the same kind of sense of smell?
Not everybody has their own. Like there's a lot of variability.
Okay.
Variability there. So, you know, like I came here and I realized, wow, there's a whole intramural program. There's people that are
intramural. So that's like the NIH. We fund so many researchers across the country.
Yes.
But we also have a lab, a very sophisticated lab here on campus in Bethesda and actually several other places around the country. right?
Yeah.
And then you're a researcher in that intramural program.
Yes, I'm in the intramural program. But, when I was in grad school, one of the things that, they always tell you about is the NIH from that extramural perspective, like always funding research.
Right.
And then I come here and I discover a whole lot of labs.
I mean, that's, for me, I'll tell you, Paule, I knew about the intramural program as a theoretical thing before I became director, but it's been one of the most fun things for me is to start to meet some of the amazing scientists who are here at the NIH doing work on, just the most widely varied sense of interesting, important things. And, it's the history of it is incredible. We've had scholars who've gone on to win Nobel Prizes. We've had fundamental biological advances in knowledge that have helped countless patients.
Yeah, no, and I think that's that it's important that the public really knows and understand that we have this other side of NIH where we have scientists that are dedicated to finding innovative answers to questions, so finding answers to innovative questions, and that can help the American people.
Okay, so let me just confess straight up front why I invited you to come as the first intramural researcher. Your research is absolutely fascinating to me. I mean, I never understood that there was this link between the sense of smell and taste and some of the health conditions that affect tens of millions of Americans. Right? So for instance, obesity. How are the sense of smell and taste linked to our body weight? I mean, I never thought about that until I met you.
Yes. Well, one of the things, a lot of people are in the same shoes that you are right now, where we don't necessarily think about these senses. We think about pain, we think about vision and hearing, but when it comes to taste and smell, we don't think about it. But what is one thing that we do all the time is eating. So our sense of taste and smell influence our food choices, nutrition. So you can think about when an individual has a decreased sense of smell, does that mean that they are most likely to increase their salt consumption or their sugar consumption to get that pleasure that, we're looking for in food? So, or the opposite could be true too. Like, is it that obesity is also, damping or decreasing the senses of taste and smell?
I mean, so if I wanted to lose weight, right, for instance, so should I just somehow figure out a way to get my sense of smell to be less? Would that work?
Not necessarily. That's not what I'm saying. But
by the way, don't do this at home.
Don't do this at home. But it's really about having that understanding that these senses are important, and and that it does influence our nutrition. So if we can think about one of the particular questions that we were really interested in is how ultra processed foods or unprocessed foods, does that affect
it seems like those foods are almost tailor-made to appeal to people's sense of smell and taste, to make you want to not just eat a little bit of it, but just keep eating it.
There's a lot of marketing around how a food tastes.
But they're marketing a kind of biology, right? So it's not just marketing in a void. It's marketing in a way where they understand human biology of how do I make the potato chip smell or taste a way that I would want to continue eating, much more than I ought to.
Yeah, it's a bit complex, but that's one area. But the area that I'm particularly interested in is the area of health. Can we understand what is happening to these very important senses and how they relate to these diseases like obesity, neurodegenerative diseases like Alzheimer's. There was a recent paper that showed how smell and taste are related to about 139 conditions.
So is it in okay? So I'll just tell you, when I had COVID a few years back, the first time, I lost my sense of smell.
Yes.
Right. So there you have a disease changing my sense. Right. It was actually, honestly, a very strange experience. Right. So I couldn't smell ketchup. I couldn't smell mustard. I actually ate much less than I otherwise would because I just didn't have the desire for it. Right. And it was also strange when it started to come back. I was like, every day I would test myself and say, okay, is this? I actually had my wife do this. She'd put mustard or vinegar or something very strong, And for a long time, it was like nothing. It was very odd. And then about a month in, it started to come back.
Yes.
I could send. Then all of a sudden, it all came back, and I was back to normal. Is that so? Is that typical? Is it that you have a condition and then that changes your sense of smell and taste, or is it the other direction also sometimes, where different maybe the genetics of how you smell is slightly different from other people, and that can lead you to be to eat too much, or lead you to I know you study alcoholism disorder, things like that. Which direction does the causality run?
So that's a great question, and I think that's where the nuance comes. Like, it could, one of the things that it could happen is like when COVID. One of the things when COVID, it was very clear the disease was causing these senses to be altered, right?
Yeah.
And one of the things with COVID in particular that made it very interesting to us sensory scientists was the fact that, people do complain about their taste or smell going down when you have a cold, for example. You have the flu, you have a cold. And that, it's normal and it comes back right away. But with COVID, it was the number of people that were being affected and like the magnitude by which these things were happening. So in that sense, we have that directionality. But in terms of understanding the other way around, it's one of the things that we're really interested in understanding. That's why I think, there's a lot of research being done in this area to try to see, okay, what comes before the chicken or the egg, especially when it comes to Alzheimer's or Parkinson's disease, right? Which we had discussed at some point, because is it the disease that is happening that is causing this thing, or is it because, this is happening so much earlier that is leading us to, that is sending that signal?
Yeah, I mean, in a sense, it would make some sense that the disease might modify your sense of smell. I mean, Alzheimer's affects many parts of your brain. The sense of smell isn't just your nose.
No.
It's your brain, how your brain processes the chemical signals that it's receiving. That matters quite a bit, right?
Yeah, absolutely. And, one particular fact that many people don't know is that, the sense of smell is the one sense that's directly linked into the brain, especially into our limbic system, which is tied to our emotions, memories. So this is why sometimes what happens is like there's an alteration in quality of life of individuals. I often hear, but I'm not gonna, like, people are not gonna die if they can smell. But it's a there's a lot of depression that people start exhibiting. You can think about, if you can smell, how that affects relationships as well. At some point, I had a patient that didn't really want to even go out because they were worried about their body smell, right? That they couldn't tell. So there's a lot of different things that we often don't think about that are very important to patients.
I mean, like the sense of nostalgia when you smell something, like some dish and it smells like something your mom made when you were little.
Yes.
That kind of thing, right? Or vice versa, right? Where you, I mean, it was really odd when I had COVID and I couldn't smell. I had no hunger. It was very strange.
And and that also brings another example, which is cancer, right? Like if you have cancer and you're getting chemo or radiation, that would also affect your sense of smell and affects your appetite. So so this is in terms of like that connection between smell and taste and nutrition that is very, very important, but also safety. If you can smell something that's burning, in your kitchen, that can actually increase someone's safety issues and safety hazards.
So I mean, I think I know the answer to this question, but I'm going to ask it anyway. So, why should we learn more about this? Like, is it going to be, is it going to help us manage patients better, give them better advice? What's the end goal of this research?
So, why should we learn more about this? And that's also a question that I often get. And it's, it's some of the things that I just mentioned. It's important because it signals disease that we often don't think about.
So we can help doctors better manage their patients, right? So
yes,
that they can
absolutely.
understand early signals of things happening to
patients.
Yeah,
and I'll give you an example. So my own mother-in-law, one of the things that we noticed very early she came to visit and she stayed with us for a while. And we were noticing that her food starting to taste quite salty. And, even her cake, which she makes amazing cakes, by the way, it tasted so sweet. And, as a sensory scientist, I was like, oh, and a nurse, I was like, okay, something is off. And then we noticed additional symptoms. And that led to a cascade of different examinations. And this is how we learned that she had frontotemporal lobe dementia. So, and, just for those that are listening, this is the same disease that Bruce Willis has, for example. So that was like
it's like an early detection signal.
Early detection signal. And we know it happens at least 5 to 10 years.
And I mean, I think also understanding how these disease processes work often lead to discoveries that you never anticipate, right?
Yes.
Maybe interventions that will help people in ways. So even when you can't say, okay, well, this is the drug that came out of this, the kind of fundamental biological knowledge is crucially important for patient health in the long run.
Absolutely. And I think that, one of the things that also COVID highlighted for us was the need for testing, the need for screening around taste and smell. You go to the doctor, you'll get your blood pressure checked, they'll ask you how much is your pain from 0 to 10. But, have you had your sense of smell tested?
Paule, I have not had my sense of smell tested. And actually, I noticed, I couldn't help but notice that that you brought props with you, scientific props. And I think my sense of smell is about to be tested, my friends. So we'll see how I do. Is that what this is about?
Yes. So I brought some of the tests that we actually use in our lab. This is what we call the sniffing sticks.
Sniffing sticks. Okay.
Yes. So these are like pen-like markers that have different smells. And
okay.
It has what we call identification, discrimination, and intensity.
Identification, discrimination, and intensity.
And I'll tell you what they are. So like discrimination is like whether you can smell something or not, right? Like can you tell us what that smell is? And the discrimination is identifying which one has an odor when you pair them when we give you two different props.
The smell difference between tap water and chlorine pool water or something.
Yeah, something like that, but a little bit more sophisticated.
Okay, by the way, I don't know what's coming, so this is really an experiment.
Yeah,
so.
he has not done this.
Okay.
And then the intensity one is just what we call threshold is sensitivity. It tells us like how much of that smell can someone perceive. So
like smelling salts.
Yes. Yes, so we have that, and then we have the University of Pennsylvania smell identification test, which is a very popular one, which is translated in many languages, I think about 40 or 60 languages, and that's specific for identification. So once we do these tests, we get a score that tells us, in this particular one, whether you have what we call anosmia, which is complete loss of smell, or you have hyposmia, which is decreased sense of smell, or you are normosmic, meaning that you have a normal sense of smell. So there's different scoring. And then when the identification...
There isn't one for like super sense of smell, like...
No, not yet.
Right,
not yet. No. That's something that
probably
we
wouldn't have that, so we'll see what happens.
I'm sure your wife does.
Yeah, probably.
and we have this particular test here, which is the Monell flavor quiz, and it has both smell and taste combined. So we actually even have a nose clip where that we give to individuals, especially when they're doing the taste component, because so one of the things that most people don't realize is that we have what we call orthonasal olfaction, which is when you smell something, like you have the food in front of you, you smell it, or retronasal olfaction that happens in the back of the throat. So think about, pinching your nose and then releasing your nose, and then now all of a sudden you are discovering new flavors. So that's orthonasal olfaction. So we often block the nostrils so we know that what we're measuring.
Oh, neat.
It's what we're measuring. And the last one here is Sentinel Rapid Smell Testing, which was actually developed using the RADAX initiative during COVID. So we funded this type of work, and it's a screening test. So it's very simple, very easy. It's not diagnostic, but it's screening. And one of the things that I mentioned at some point is the need for screening tests. We need to have something that is easy to use in clinics for the physicians and for the patients.
Right. Okay. So you brought these to test me.
We're gonna try.
All right. Let's do this. This is gonna be fun. Let's have it.
So we're going to bring one of our postbacks.
This is one of your star students.
This is one of the star students here at the NIH.
Paul, you have to give us her name.
Okay. She is Lizzie Hall. And Lizzie is a postbac who is going to be going to nursing school.
Well, Lizzie, it's nice to meet you, and thank you for your willingness to help me go through this crazy test that Paule has brought for us.
It's really nice to meet you too. I think the background for all the tests that Paule gave is really great. Is there any specific one that we should start off?
We should probably do like identification, like.
Okay, I'm gonna be bad
so it
at
would
this.
be. So
I'm going to be bad at this. I can already tell I'm going to be bad at this.
And then we'll send you the results. So we don't.
Okay.
We don't.
No, it's okay. I failed tests before. It's fine. Not many, just stuff for.
Alright, so we can pull this out. So this is our test sheet.
Okay.
And then, so for this test, you're going to be smelling the marker, and these are the options that you have.
Okay. So the options for this marker are A, orange, B, strawberry, C, blackberry, and D, pineapple.
Yes.
Can I tell the difference between an orange and a pineapple? I guess we'll find out.
All right, so here's the pen. So you're going to have it up under your nose. Yep, and you can just smell it for a few seconds. So
that's got to be an orange. How could it not that be an orange? That's definitely an orange. Do I get an answer?
Try to? Yes, I will give you all. We give you the
okay,
answers.
we're gonna actually grade my test, you guys. All right, this is the second test. Okay, this is much less fun. This is A, smoke, B, leather, C, glue. I might be sniffing glue, and then D, grass. That's not glue. That's leather, I think. We'll find out. All right.
So we'll do this, and then Lizzie will do the calculations, and we'll tell you how many you got right.
Pen number 3. Here comes pen number 3. Hopefully, I'm not sniffing glue. Okay. This is way better. Honey is A, B is chocolate, C is vanilla, and D is cinnamon. All right, let's smell. That's cinnamon.
Are you sure?
Cinnamon? That's got to be cinnamon. It's got to be. I think I'm not going to fail this one. Probably.
You won't fail these tests.
I was pretty good at school, so I didn't fail that many tests. I did a few, and I still seared in my memory, you guys.
Yeah, and as you're doing this, again,
by the way, I would have failed this test when I had COVID.
During COVID. And
yes.
One of the key things is we don't have baselines for most people. When I was telling you in terms of how many times have you gotten your smell and taste measured? And for most people, it's never. But how do we, as you said, your sense of smell came back, but to what degree?
Right.
We don't know. And that's why we need to be able to have testing.
It felt very intense when it finally came back, actually. It was very interesting. I had this hypersense of smell. It's gone now, but...
Now you're back to some normality.
Normality, yeah.
next one.
Okay, I don't know what A is. It's chive. Apparently some sort of oniony thing. I'm not a cook, right? So B is fir, which is like a tree, like an evergreen tree. C is peppermint. I hope it's peppermint because I know peppermint smells like. And then D is onion. Oh, that's peppermint. Oh, yeah, that's fantastic. Thank God it's not chive because who the hell knows what that smells like? All right.
We're getting there.
Pen number 5. How many pens do we have?
So we have 16.
Okay, we should speed this up then.
Yes, let's do it quickly.
Let's go. This is A is coconut, B is walnut, C is banana, and D is cherry.
Let's see. I can smell that one.
Oh, that's banana. It's banana. It's obviously banana. Thank God.
All right.
What does walnut smell like? I don't even know what walnut is. Has anyone ever smelled walnut before? Okay.
There's a smell to it.
I have to go now. I'm curious. I got to go get a walnut to smell it. We're doing good. All right. Pen number 7. Licorice is A. Cherry is B. C is spearmint, and D is cookies, although it doesn't specify what kind of cookies. So.
That's true.
Licorice. I love licorice, so that's a simple thing.
Yeah, it smells good.
Yeah.
Yeah.
Not everybody loves licorice, though.
That is like
Strange
but
people.
I kind of grew up with that smell, so it's easy.
Pen 8 is A is mustard, B is menthol, C is rubber, and D is turpentine. I don't know if I could tell the difference between rubber and turpentine, but I guess we'll what is this? Okay, I'm gonna fail this one. It's not menthol. It's not mustard. It doesn't smell like turpentine. I'm gonna say turpentine. Probably turpentine.
Yes. And this week it's hard for patients. You can think if they're having, some cognitive issue.
Yeah.
Sometimes it's really hard to recall
what the
smells.
Oh, that's interesting. Yeah, because it's not just a test of smell, but also of memory.
Memory, exactly.
Yeah. Although, the idea that somehow smell is so deeply rooted that our memory comes back out of it. That's a really interesting idea, right? Okay, A, onion, B, garlic, C, sauerkraut, and D, carrot. Again, uncooked carrot. I don't know that it smells like anything, so we'll see. We'll see what happens here.
Carrots have a smell.
Oh, that's garlic. So I lived in California, and if you drive through a certain part of California, Gilroy, California, you smell that right there. That's because they grow garlic there. Yeah.
Not my favorite smell at
I
all.
love garlic, actually.
Really?
I'm good with that. Yeah. A, cigarette, which I hate. Don't do that. If you smoke, please stop.
Yes.
B, coffee. C, wine, and D, smoke. That's coffee. Yeah, it's definitely coffee.
I think your sense of smell might have come back.
It's probably. I mean,
We're almost there.
We're almost done. Pen number 11. A, melon. B, orange. C, peach. And D, apple. Oh, that smells so good. What is that? That's melon. That's probably, yeah, I was going to say it's melon. It's not orange. It doesn't smell like peach.
And it smells good.
It smells good.
Some of the smells are not that great.
Well, if you had turpentine, did not like the turpentine. A, clove. B, pepper. Well, it doesn't say what kind of pepper. C, cinnamon, and D, mustard. That's a clove. That's definitely a clove.
This is like...
Well, so Indian cooking uses cloves a lot. So that makes me think of when I was little and my mom was cooking.
Yeah. You see, it brought to your memory.
Yeah, it did.
There you go.
A, pear. B, plum. C, peach. And D, pineapple. Oh, that smells so good. That's a pineapple. That's definitely a pineapple. Although, who knows?
Seems like you like a lot of different
I love
smells.
fruits. I love fruits. I like fruits.
You like fruits.
I'm a big fan. If you have to eat fruits and vegetables, then if you eat fruits, then you've eaten fruits and vegetables.
Yeah, that's true.
Okay. And then what is this? This is A, chamomile. B, rose. C, raspberry. And D, cherry. Okay, ready? I think that's a rose. It's probably a rose. I don't think it's chamomile. That's not chamomile. What does chamomile smell like? I'm more of a black.
Smell.
I'm a black tea more kind of person, so I don't really drink too much chamomile.
For your sleep and all of that. Maybe chamomile.
I don't sleep that much. So okay, so
Me neither.
A, anise. B, honey. C, rum. And D, fir. Always with the evergreens. Oh, what is this? Oh, that's anise. It's like licorice. Yeah.
Yes, it's like licorice.
Although if you told me the difference between anise and licorice, I wouldn't be able to. That's
it's and you can think of also the cultural component of this, because there's some people that might not be able to tell what a smell is. It's not because they don't know; it's just because they've never been exposed to it.
Right.
So that's why having different types of smells is also important. All
right, last one, pen number 16, and I could be 16 for 16, folks. We'll find out. Afterwards, A, cheese. A, bread. B, cheese. C, fish. And D, ham. Okay, this one's hard for me because I've had some very smelly cheeses before. But I think this is fish.
Okay. Well, so now Lizzie will tell us how many you got right.
Okay.
And then we'll continue our conversation.
I'm about to be graded, folks, so we'll see what happens.
But, it's, it's as simple as what you just did, or even simpler, which only there's one smell under one of these cards.
And, you could imagine doing this for patients to try to understand these facts about that aren't readily available to us.
Exactly. So, one of the things that it's important to note is that we don't have clinical guidelines that can guide clinicians onto, what do you do? Like, so if you walk into a doctor's office or a clinician's office right now, and you said, I can't smell, or I feel like, my cooking is off, I can taste something.
Right.
Most likely they won't know what to do. So one of the key things that we're doing, and as you know, we inaugurated the National Smell and Taste Center here at NIH last year, and one of the key things that we are interested in is besides the research, is education for clinicians and patients, and also finding out treatments. There's no treatments that are available for people that lose their sense of smell. So you can think about what is needed, and clinical guidelines is one of those. So we are really committed in, advocating for creating clinical guidelines. As you know, we can advocate for certain things, but we worked with the National League for Nursing to try to incorporate chemosensory health into the nursing curriculum, so that nurses who will be graduating with a nursing degree will know more, whether they are advanced practice nurses or bedside nurses. So when the patients complain, they at least will know more about these senses.
Like this, it's kind of like these basically you expand your set of diagnostic acumen, right? You're another tool for nurses and doctors so that they can take better care of their patients.
Absolutely. And that's what it's all about. How can we improve health outcomes? How can we empower patients and to ask more questions, and to be knowledgeable that these senses are also important for their health.
Right. Okay. Do you think we have the results of the test yet? Okay. We have Paule. Okay. I'm a little scared, you guys. What if I got several of these wrong?
Let's see.
Find out.
How many did he?
So you got 15 out of 16.
Whoa, that's
really
good.
No, I failed.
Maybe it was a turpentine.
What was it? Was it turpentine?
It
wasn't.
Was number 11. You chose A, and the answer is B.
Okay, what? Oh, let's go find it. Now I'm curious. I got to improve next time I take this test. There are these tests of memory.
11. So I think
I picked
you picked A.
melon, and it's actually apple.
Yeah.
There you go.
Okay.
So
it smelled really good. That smelled really, really good.
I think the fruits are sometimes hard to differentiate.
Yes, indeed.
So, but as I said, the test is a little bit more comprehensive. It will take a little bit more time because we need to get 3 different scores, combine them, so it can tell us, how your sense of smell is actually doing. But this is a great...
You're saying I did okay.
You did okay. You did great. But it's,
I wanted a perfect score, though, Paule. I wanted a perfect score. We'll have to work harder.
So, so these are it's a great example. Thank you for being a good sport and demonstrating to the American public that, how a smell test is actually done.
Well, Paule, thank you for coming on the podcast with me. And I'm so grateful to have this chance to learn from you about the science of smell, and how at the NIH we're working toward taking that science and making the lives of people better.
Yeah, no, absolutely. Thank you so much for having me. This is actually really fun. I'm really glad that you were a good sport, and I wanted to try some of the things that our patients do every day.
Thank you so much. Thank you for joining me again. And to our listeners, thank you for tuning in. Drop your comments in the chat as to what subjects we should cover. Be sure to hit that like button and subscribe button on your preferred podcast platform. Until next time, I'm Dr. J. Bhattacharya for the NIH Director's Desk.